Good morning, everybody. Hello, Dr. Nicola Ducharme here. So the topic of the day is everybody's favorite topic, intestinal parasites. Yep, it's a charming one. Everyone loves to talk about it, but we need to talk about it because a lot of people experience intestinal parasites. So I wanted to just kind of give you, a rundown of how I evaluate that, how you might know if you have parasites, what that could mean for your health with other existing conditions, and let's talk about some solutions. So first of all, how would you know if you have intestinal parasites? Well, I have a lot of patients that say that they see things coming out in their stool that look like they could be worms, okay? So some people do get visual indicators that there is something amiss going on. But the first distinction to make about intestinal parasites is that there are sort of two categories. One is the microscopic parasites, so things like Giardia, Blastocystis hominis, Entamoeba histolytica, Cryptosporidium. Those kinds of parasites we can certainly test for, but you're not going to see them necessarily. They're microscopic. Then the second category is what we call helminths, or more commonly known as worms, like roundworm, hookworm, pinworm. Those can be visible. Okay, so that's just the first distinction, that we have our microscopic parasites and then we have our more visible helminths. And they can both cause similar symptoms. So very classically, I hear gas, bloating, abdominal pain, itching, like rectal anal itching, but also itching all over the skin, anywhere over the body, diarrhea or constipation or going back and forth, sometimes nutritional deficiencies, because parasites obviously, by definition, they're kind of living off us. And so they can be stealing nutrients from your food, and subsequently you're not able to absorb all the nutrition that you should be able to get. So there's lots of different symptoms. Parasites can also be associated with like more neurological issues. They can have fairly widespread symptoms that they create, but especially, like, most people will know something's not right in their digestive system. So the first thing then is, how do you evaluate for intestinal parasites? Well, the most common way I would test for that is to do what's called a comprehensive stool analysis. And there are many labs that offer this. I actually really like Great Plains Lab. I use a lot of their testing. They have, as well as just, looking at dysbiotic flora, all these different, inflammatory markers, etc. They have now incorporated many, many parasites in their comprehensive stool analysis. So that is a great way to get that information. It does take a couple of weeks. So sometimes if someone has a really acute episode going on, sometimes it's worth going to LabCorp or Quest and getting a lab test that can turn around quickly. However, typically they're only looking for a much smaller number of parasites in their ONP, is what they call it, ovarian parasite test. So they're looking for the main ones, Giardia, Cryptosporidium, but there are many others that a more specialized lab test could look for. And so I always think that's the way to go to get the most information possible. The other thing I would make a note is, and I remember this from years back when I was brand new in practice, and I had a new patient come to see me with all kinds of digestive issues. And, there's a little workup I do when somebody comes in with digestive issues. It's, gluten intolerance, it's food sensitivities, it's parasites, it's candida, like the main things that I want to test. And in the absence of a more systemic illness or other symptoms, if someone's just coming in with GI issues, pretty much it's going to show us the information in one of those tests. So she came back gluten intolerant, and she came back with Blastocystis hominis. And this poor girl had been having diarrhea every day for months and months, and she'd seen the GI docs. Nothing came of their workups. So I was so excited, thinking, oh, we've found the solution for her. And if she cuts out gluten and we treat this blasto, she's going to be doing so much better. she took that information back to her allopathic doctor, her regular MD, primary care, and said, hey, I saw a naturopath and this is what she said. What do you think about this? And he said to her, he goes, I don't think that test is valid, and everybody has blasto. It doesn't cause, it's not a disease causing, parasite, and so we don't even need to treat it. And she believed him. And so she, as far as I know, never treated for those things. And I'm thinking, oh my gosh, like she could have had such an improvement in her health. So it's something to be mindful of, that there are some parasites that will, that won't cause symptoms, put it that way. Like, I mean, really anyone who eats sushi, like there's just, it's so easy to get parasites. So there are some that can just sort of coexist and not cause a lot of issues. But just bear in mind that there are also some that can cause issues, but that some doctors don't recognize as being what we call pathogenic or like disease producing. So there's that. So the comprehensive stool analysis I really love. It is part of my GI workup of like, okay, what's going on? What's this digestive system not happy about? Because it does give information on parasites, but also on bacteria, on, how much good flora somebody has, and the fact that it will test for the microscopic parasites as well as the worms, to me is excellent. That's what we want. Now, especially with the worms, it doesn't always come up. Usually the parasite stool testing is over a 3 or 4 day period because you want to try and catch the parasites in their life cycle. But they don't always show up. And sometimes we say, look, we'll just do some, an anti-parasite kind of cleanse. And I'll talk a little bit more about that in a few minutes here. So let's turn now to kind of more solutions. Like if you do test positive for a parasite, or if you are really seeing things coming out in your stool, the other thing to note about that is you are able to send, like if you extract what you consider a worm from your stool, you are able to send that to, LabCorp or wherever for identification. In some ways, depending on how you're going to treat, does it matter? Maybe, maybe not. If you're going to do medications, and this is true for so many things in natural medicine, if you're going to take a herbal approach, it doesn't matter so much because our herbs, our plants in nature are more broad spectrum. Whereas sometimes if you say, okay, I'm going to take a medication approach, it matters more because different medications have more propensities for different pathogens. And that's true, in my work with Lyme, that's very true as well about co-infections and such. So big picture, if we're looking at parasites, we have a certain range of priorities. Okay, so obviously we want to do something anti-parasitic. We want to kill the parasites, right? But it's more than just that. The other priority is we want to break down biofilm. And sometimes when people pass things that they think are parasites or worms, it can actually be biofilm. It can be like ropey, stringy substance. And it's kind of sometimes hard to tell them apart. I've certainly had patients who've sent me pictures and go, what do you think this is? Brenda's like my front office person. I don't mind because, that's sort of part of my world and that's part of our job as doctors. But sometimes my staff are like, oh, I wasn't expecting that. Anyway, so we want to break down biofilm because the biofilm is sort of the sticky goo that can be created in the gut. And sometimes, bacteria and parasites and whatever can live in there and they hide. And so we have to be actively sort of breaking that down so that whatever antimicrobial or antiparasitic treatment we're doing is going to work better. The other thing we want to do is make sure we're kind of sweeping the bowels, that if we're killing off parasites, that we're actually moving the debris out. So we want to make sure we've got things like fibers that can help sweep and move through. And sometimes we also want to use binders to, mop up toxins and just to kind of help drag things out. So the one risk about binders is they can be constipating for some people. And that's the last thing you want. My daughter is about to creep across. Go ahead, Valentina. This is called working from home. So the last thing you want to do is be constipated if you're killing off, whether it's yeast or parasites or whatever, you want to get them out of the body. And so we can do that with binders, we can do it with fiber, we can do it with coffee enemas. I'll talk more about that in a second. And then lastly, we want to create a healthy microbiome. Okay, so the more there is healthy flora in the gut, the less the pathogens like parasites and bacteria and yeast overgrowth and things can take a hold, right? So the more we build up the healthy flora and the more we help the immunity of the gut, the more protected we are from getting these kinds of infections in the first place. So talking about some treatments. So let's talk a little bit about medications first. There are times where I will come in and I will do medications. Like if I test someone and they're positive for a certain parasite, I'll come in with a medication and do, a 10-day course or even a 20-day course. The medications we choose do depend on what parasite is present. Okay, but some of the more common ones, I use tinidazole, which is also called Tindamax. It's a cousin of Flagyl, but it's easier to tolerate. It has less GI side effects. Can be expensive if insurance doesn't cover it. And in that case, compounding is the way to go. It's a lot cheaper to get it compounded if we're trying to get, quantities above what insurance wants to cover. Sometimes insurance will say, tinidazole for Giardia, that's a 3-day course. We'll cover 3 days and that's all we're going to cover. So if we want to go for a 10-day course, which is not uncommon in my experience, sometimes getting it compounded is best. Flagyl is usually covered. It's just a lot harder. It's a lot rougher. So depending on what the microscopic parasites are, tinidazole is a favorite. Alinea is another favorite. It's on label, I think it's Cryptosporidium it's designed for, but it's got some good broader spectrum antiparasitic activity as well. What else do I use? There's a medication called iodoquinol. It's older. It's a little bit harder to find. I usually get it through my compounding pharmacy, but that can be a good one as well. Sometimes I'll do like 10 days of tinidazole, 10 days of iodoquinol, and that will be helpful. What else? Alinea. They're the main medications I use for the microscopic. And then obviously for the helminths, for worms, we've got a slightly different set of medications. We've got praziquantel, we've got albendazole, we've got what else is on that list? There's a range of them that are more designed for worms. I don't use them very much. I will say, and I know in the Lyme world, there are some Lyme docs that do these massive protocols of, antiparasitic medications. I think that's pretty rough and hard to tolerate. And I have found herbs work really, really well. So I typically go more of a herbal route, just because those other medications can be really, really hard on the system. So looking then at herbs, and I'm going to keep this simple because there's lots of good antiparasite stuff out there. I'm just going to give you a couple of things that I have as my favorites. And I've actually got them here to show you. My 2 absolute favorites for parasites, Mimosa pudica. And then I have an anti-parasite formula that has, the black walnut and wormwood and quassia and clove and some of the really strong antiparasitic herbs. I have had very good results with this anti-parasite formula with candida overgrowth as well. I've had numerous people, their toenail fungus cleared up, like so many different things that are more yeast related. But it was designed as an anti-parasite formula. When you start taking antiparasitics, it can be really important just to go very slowly. And again, depending on your sensitivity level, it can throw you for a bit of a loop when you start out and you can feel kind of unwell, more GI upset, fatigued, headaches, all these different things. So just go slowly with the antiparasitic part. In terms of biofilm, I have a couple of favorites for that. And when I'm just talking about sort of gut stuff and parasites, it's a little bit different to what I use for sort of my classic Lyme biofilm agents. There's definitely overlap, of course, and there is an association between parasitic infection and Lyme disease. And so doing anti-parasite stuff for a Lyme patient could be helpful. But what I'm talking about today is really just kind of like, let's just talk about parasites. So here are my two favorites. This one is BioDisrupt by Research Nutritionals. It's a newer formula. It's great. I love it. It does have an enzyme blend in it. Now this and the other one I like, Interphase, both have enzymes derived from eggs. Okay, so neither of these are good if you're intolerant to eggs. And then you would use something like lumbokinase, serrapeptase, nattokinase, those kinds of things that don't come from eggs. So there are definitely options. But these two are really good. Now, this BioDisrupt does have peppermint oil in it. Peppermint oil is very good for breaking down biofilm, but it's very strong. And I can vouch for that. It tastes very pepperminty. So if one doesn't tolerate mint well, then this is not going to be your best friend. This Interphase Plus would be a good option. Which way am I going? That's by Claire Labs. That's a very good formula as well. What else have I got? Now, in terms of binders, this is probably my favorite, GI Detox. I use this for a lot for people who are doing candida treatment as well. This is a great natural binder. There's another one called Ultra Binder that I like. However, I tend to use Ultra Binder more like within the mold context, and I use GI Detox within the mold context too. But I think for intestinal stuff, this GI Detox is excellent. Like I said, though, if you're going to be binding, you have to be getting stuff out. So I think extra fiber and things to help sweep the bowels can be really helpful. This Mimosa pudica also, it's a seed. And as well as being antiparasitic, it also has the ability to kind of bulk up and help transit through the bowel. So that's another thing I really like about it. So the GI Detox, just make sure it's not slowing down bowel movements, because that would be counterproductive. Now, for people who are really constipated, one of my favorite things is called Oxy Powder. And I think it's Global Healing, something, Global Healing International or something, the company that makes it. Oxy Powder, it's the only one out there. And it's sort of a special formulation of magnesium that just works really well. And we use magnesium for a lot of different things. And for some people, like regular magnesium citrate or glycinate will be enough to help move the bowels. But if it's not, then Oxy Powder is really, I've seen it be so, so helpful. So then we have recolonizing the gut and making sure the microbiome is as strong as possible. And I have a range of different probiotics I really love. The one I grabbed today is called Core Biotic. And the reason I grabbed this one is because it's soil-based, and that can be very well tolerated by people who are more sensitive. Okay, so I have a powdered probiotic that I have formulated, Dr. Nicola's probiotic powder, strangely enough. And that's super duper high potency. Like one scoop of that is 200 billion CFUs. This one is 11 billion per serving. So it's not in that same intensity. However, the Core Biotic, being soil-based, is a good choice for people who have SIBO or people who don't tolerate other probiotics well. It does not need refrigeration. My powdered probiotic is really good for people who need really intense probiotic therapy. So certainly my Lyme folks on antibiotics, people who are on antifungals, things like that. So some people do benefit from doing like one course of that at a higher dose and then maybe just going down to a half a scoop of the powder. It must be refrigerated though. And I typically advise people to take that at night, and it needs to be mixed with, you know, water or something. So a lot of people who end up forgetting that, I'll give them like Core Biotic or another probiotic that does not need to be refrigerated. The nice thing about my powder is it's actually very economical. So it only comes in one size, 50 gram. It's $100 a bottle. However, at the half scoop dose, which is 100 billion CFUs per day, it turns out to be about $25 a month. Whereas the other 100 billion CFU non-refrigerated capsule we have a Zymogen one that we use, that's about $70 a month. So it's a big difference. So it's economical, but it's just a trade-off of if it's in the fridge, will you remember, et cetera, et cetera. The other point is probiotics want to be 2 hours apart from antiparasitics, right? So we're talking about, you know, the antiparasite formula, Mimosa pudica. If you were to be taking albendazole or tinidazole or one of those antiparasitic medications, probiotics always need to be 2 hours separate from that. Otherwise, those antimicrobials will just kill off the probiotics. So you'll just be wasting your money there and not getting the benefit. A couple of other things I've discovered along the way. This one has been around for a while, but I've just discovered it. I know it's shiny. It's by Pure Encapsulations, and it's called Liver GI Detox. And it's a really nice combination of herbs and nutrients that support liver detoxification, plus digestive support as well. So it's got some glutamine, it's got methionine, it's got chlorella sort of as a binder and detoxer, and then it's got turmeric, milk thistle, broccoli seed extract, which are all very good for phase 2 liver detoxification, and alpha lipoic acid and N-acetylcysteine. So this is a whiz-bang little formula that I've just tripped over lately and probably will start incorporating more into my protocols. Finally, before we wrap this thing up, I just do want to make a point about coffee enemas. So a lot of my patients do coffee enemas for a number of different reasons. One of them is supporting the immune system, also helping with detoxification. That's one of the big ones. You know, if you're feeling toxic and headachy and tired and, you know, joints are aching and all of that, sometimes coffee enemas can just clear all of that through in a really short period of time. But they also can be helpful for sort of clearing those nests of parasites or clearing candida from the bowel. Obviously, when you're doing an enema, the fluid isn't getting all the way through the large intestine. It's not getting as far as it would if you did like a colon hydrotherapy session, for example. But I have spoken to so many of my patients who do coffee enemas and see all kinds of things coming out, right? So typically we don't test to see, you know, is that actually a worm? Could it be biofilm? Like, what are we looking at here? But they do clear as they do more enemas, and then we incorporate antiparasitics and biofilm agents. They definitely do clear and get less as time goes on. And so I do know that coffee enemas are a great adjunct when you're trying to overcome parasites, especially if it's more chronic. I mean, if you go to, you know, Mexico or go to a restaurant that somebody hasn't paid attention to hygiene, or, you know, one of these countries where parasites are very common, and you come home and you've got, you know, what do they call that? There's a couple of expressions for it. In Australia, we used to call it like Bali belly, if you go to Bali and come home with a tummy upset. But, you know, if you have an acute parasite and you're otherwise healthy, I mean, in my view, I'd knock that out with a medication and sort of, you know, go happily on my way. However, there are some people that deal with this on a more sort of chronic scale and deal with it in conjunction with other health issues. So it's an important thing to address. Like I said, there are correlations between parasites and Lyme disease. There are correlations between parasites and heavy metals. And that's where as well, doing those biofilm breakers, especially, is it the Interphase Plus has EDTA in it? Yes, Interphase Plus has EDTA in it, which helps to pull metals out of biofilm, which helps to destabilize its structure, if you will. So, you know, you can just do anti-parasite herbs. You can just address it that way. But I always like to be kind of comprehensive, look at the whole picture. And also in looking at, you know, how are those parasites getting there in the first place? What else is causing either an inflammatory state in the gut or an immune issue? Our gut has its whole own immune system. So we want to look at secretory IgA, which is our main immune cell in the gut. And that will actually get measured on a comprehensive stool analysis as well. So we can see if somebody has enough immune protection, or if their secretory IgA is high, we know that they're having an immune response to something that's going on. So we always want to be, you know, holistic about it, looking at the food sensitivities, looking at gluten intolerance, looking at, you know, candida overgrowth can come as a secondary effect from parasites, because remember, anything that creates imbalance or, you know, inflammation in the gut can render one more vulnerable to candida overgrowth. So, I mean, you can just go in with the antiparasitics and just kind of try and get rid of it that way. But I do think for true and lasting healing, you want to consider some of those other things too, like, you know, healing the gut, replacing the supporting the microbiome as much as possible, and, you know, using herbals, even if you do use medications, back it up with herbs to help get that gut flora back in the right direction. All right, so that's my thoughts on parasites. Do feel free to drop me a line if there's other things that you would like to learn more about, other topics that you would like me to cover. Shoot me a message. I'm always interested to hear what you guys want to know about, and I want to help share information that's really valuable to you. All right, so have a wonderful day. I will see you again very soon.